We're very excited about this new project that has launched in London. This is a universal care plan, which essentially means that it is universality in its application rather than, the universality applied to the patient. So it is part of a wider project where patients with specific areas of need, such as, for instance, end-of-life care, or children with learning difficulties, adults with learning difficulties, have a care plan that is universally accessible. It's almost like a digital solution, or solution to the difficulties in digital access of patients' individualized need in times of emergencies. So we have successfully been able to launch that in the context of sickle cell disease within London, which means that a sickle cell patient in any of the London hospitals will be able to agree on a care plan with their consultants or their specialist nursing team. And that document, which is obviously a shared decision-making document, will then be entered into this electronic platform. And once it's entered, it then gets accessed by a lot of people who are involved in the patient's care journey during an emergency episode of pain. So, for instance, if the patient rings up a national helpline called NHS 111 for non-emergency access or advice, the 111 NHS operative at the end of the telephone call will be able to look up that individual patient's care plan on the universal care plan platform. Same applies to when they call an ambulance. The same will apply for when they go to an emergency department for pain relief. The other exciting thing is that the same care plan can now be accessed by an app, which is called the NHS app, which is widely and increasingly so being accessed by patients to contact their GPs for appointments, to request repeat prescriptions. So it is an NHS branded app which is gaining a huge amount of usage within the citizenry, and therefore the fact that the patients can actually access that is really amazing. Very soon the next stage of the work will be in seeing how much of these data points are editable from the patient's point of view. So there are already existing data points such as their preferred pronouns, their other things that they can edit themselves on the app, but there will be more discussions there are currently more discussions about the editable aspect of the NHS app when it comes to this UCP platform. So very exciting. The next stages really are keeping a very close eye on how much it is being used, ensuring that people are aware of it, because obviously it is a highly helpful document for anybody who may have certain preferences for pain relief, may have allergies to certain types of opiate analgesia, etc. So it's really helpful that there is that one thing. The other very crucial thing is that often when sickle cell patients go to an emergency department for pain relief when they're in severe pain, many people with sickle cell have an ability to internalize their pain, and they often don't appear to be in a lot of pain. So very often what we are telling patients or telling healthcare providers that they need to believe the patient when they say they're in pain, rather than kind of presuming that they are there for some sort of a drug seeking trip. And therefore I think this care plan gives a lot of validity to the patient's kind of need. It's a shame that it has to be in that way, wish it wasn't like that. But it also means that there's that NHS branded, patient agreed document that they can then use. The next stage of this project would be to try and see if similar kind of digital access platform can be widened throughout the whole of England, which obviously is not happening right now. It's only London-based. But given the fact that the app is widely used in England, I'm hoping that when a patient from London goes somewhere else in England and shows their care plan in that app, that will also be taken as, it's valid. So very exciting times.